Thank you so much for joining us for the 2020 Community Baby Shower for Macastan, Osceola County. The goal of the baby shower is to ensure that all families have what they need in order to thrive. This baby shower is for all parents, mamas included, that have babies prenatal to the age of 12 months. During the Let's Talk series, we are going to be talking about 3 different things: resources that you may need while you're raising your child. The second one is supports you might need, and we all need supports, and also the opportunity to network with other families just like you. I hope you will join us for the Let's Talk series. We hope that you feel special, because you are. Let's talk.
Thank you for joining us for a Let's Talk session. Today we are so happy to welcome Dr. Dawn Robinson, and I want to thank you for joining us this morning, Dr. Robinson.
Thank you. Pleasure to be here.
Oh, wonderful. Well, before we get started with the questions that we have for you today, would you like to take just a couple minutes to tell us a little bit about yourself and how you found yourself in the Macassa Osceola area?
So I've been a practicing OBGYN for 20 years. I have 2 kids, love to read, love dogs. I started my career for 6 years in Atlanta, on the south side of Atlanta, Georgia. Then I spent almost 3 years in Dubai. I spent some time in Utah, and I've been in Michigan for the last decade. I've spent some time at St. Joe's, Ann Arbor, Kalamazoo, and now I'm at Spectrum Big Rapids. So
Nice.
I have practiced full scope OBGYN and did 9 months in South Bend, where I was taking care of the high risk deliveries in South in 2018-19. So been doing this for a little while. And that's at hospitals as small as 35 beds up to hospitals with 500 or 600 beds in 2 countries, 3 states, 6 cities. So
you've been everywhere. And now we find ourselves in the midst of some questions that moms, when they've registered for the baby shower, or even in the community when I'm talking with moms, we have some questions that are pretty typical, but we thought maybe if we shared maybe some expert advice, that it would help moms before they even have the chance to get into an office visit to see you. The first question today in our Let's Talk series, I would like to just talk about what moms can do in order to prepare themselves to get the most out of their office visit when they come to see you.
I think the most important thing is to write down their questions. First, be on time, fill out your new patient paperwork. If you're on medications, bring all your medications, and then write down your questions. There's so much information on the internet. We have to be careful where we gather our information.
Yes.
WebMD, the Cleveland Clinic, the Mayo Clinic, up to date are valuable resources, but I think there's so much on the internet that it's misinformation. So it's important to ask your team. For women who are on medications, a lot of the women or their primary care doctors will discontinue their medications before they even see an OB. And especially for psychiatric issues, it's very important that the patient talk to her obstetrician before stopping her medicines, because often that can take a low-risk pregnancy into a high-risk category if they stop their depression meds, and their depression or their schizophrenia or their bipolar rapidly worsens. That can make the pregnancy high risk. So it's always pertinent to try to review your medications with your doctors. Now, there are certain medicines, ACE inhibitors, that's one of the major ones, Paxil. Those are 2 medicines you don't want to be on during the pregnancy, but other antidepressants and many other medicines we can use in pregnancy. So it's important to talk to your team before discontinuing your medications.
Well, you bring up an interesting point there in the very beginning about writing your questions down. I think oftentimes we leave the office and we say, Oh, I forgot to ask that one question, and it really was the one question that was kind of heavy on their mind.
Right.
And then there they are, they're gone, and then they don't have that avenue, or they don't feel as though they have that avenue to connect with you in between visits.
Well, one thing I even recommend, we have technology now, so
Yeah,
you can choose your appointment date on your calendar, open it up and write the questions down at the bottom in your notes so that it's there that day. You're like, oh, I have my appointment today, and your notes are attached to your scheduled appointment, or however you do it. But that's how my mind thinks, but you
yes,
just write them down. And luckily with the electronic medical records and my chart, patients can communicate pretty easily with the offices now, with the nurses and the doctors. So that facilitates some things. I tell patients that, if it's simple questions, excuse me, if it's
uh-huh,
simple questions like, can I take my prenatal vitamins at nighttime or morning time? That's not a big question, but if it's ever questions about bleeding or anything else, then they need to give the office a call. And most OB
abs-
offices are connected to a 24-hour, 7-day triage number. So there's always someone that answer your questions.
that's awesome. That's wonderful to hear. Well, we are finding ourselves in the middle of COVID, and some of the questions that came in recently is really about the birthing experience, and now that we have COVID. And so, what I was wondering is, could you share a little bit about, here you have all of this history before COVID, Dr. Robinson, and now COVID's here. What do you see that has been different now in the delivery process, when they're getting ready to have that baby? How does that differ now that we are doing COVID protocols?
So if we start on the antenatal side with the office visits, the one thing COVID has made available more rapidly than would have happened in the normal scheme of things is telehealth, virtual visits. So low risk women now have the option to do their visits remotely. Some women, a few women have blood pressure cuffs at home already. Most women have a scale at home so they can check their weight. A lot of women like to still come into the office, but that's one positive that's come out of COVID is it has pushed telehealth virtual visits. Some
Mhm.
specialists say it would have took 5 or 10 years to get to the point we're at now. So some moms do have that option if they're low risk. Up here in Mecosta County and the county surrounding us, we do have some connectivity issues. So that has been a problem where like Grand Rapids and they may not see the connectivity issue. So during the pregnancy, there's very little effect from COVID. The main things that have changed with COVID, the biggest thing is we do a COVID swab test on all moms that are admitted to labor and delivery. So if you come in labor, we do a COVID swab on you. If you're scheduled for a C-section or an induction, we do it days before in the office. Right now, where the COVID number sits, the patients are allowed 2 visitors. At the beginning, it was only 1. We don't know how that might change as the numbers are going
Right.
up now, but they're allowed 2 visitors for that reason. Still, of course, Spectrum Health is recommending masks for everyone. We're now even required to wear goggles or face shields when we have face-to-face care with the patients. Some women ask, how am I supposed to keep a mask on during labor? It can be a challenge, but it does happen sometimes. The most important thing is when a patient tests negative, that does not protect her from everyone in the hospital and everyone in her room, even her own family. So even though she's negative then, she's seeing many, many people during her hospital stay. So we encourage, and it's a conscious effort on our part to try to encourage patients and families to keep their mask on. So those are the biggest things. We had a few patients at the beginning refuse testing, but the important thing I tell patients is it directly affects your newborn in your household. Your newborn, if you're positive, is going to need to be tested or recommended to be tested before the baby leaves the hospital, so your pediatrician knows what type of acute follow-up your newborn is going to need. Luckily, moms and babies have not been overwhelmingly affected by COVID, especially the newborns. So we've had some new studies come out, and that's reassuring. Also, it
Yes,
allows mother, if the mother is positive, to be even more self-conscious and conscientious about hand washing and
yes,
wearing a mask while breastfeeding. So originally they were wanting us to isolate the baby from the mother except when breastfeeding, and one of our dads were like, we're not going to do that at home, we're just going to be a family. So things have relaxed over time, and it's, you know, kind of common sense things. But luckily we've only had one positive mom in all these months. But we know, I was reading, maybe it was even Spectrum Health, um, I was reading this week or late last week that the numbers are increasing in our neck of the woods this time, faster
yes.
than in East Michigan. So it's hitting us on the west side and North Michigan, unlike when it did in the spring,
Mhm.
which is not surprising to me because Wisconsin and all those cases, you figure we're surrounded more by it. So we don't know how things are going to change. I just encourage moms to really wear their masks. Most patients are. Some of the asthmatics or the patients with severe anxiety find it difficult, but the rest of the moms, you should really encourage mask wearing for yourself, your family, your children over 2. Consider social distancing if you're going to be out and about, preferably outside. The CDC and Dr. Fauci are recommending against Thanksgiving gatherings, except with people that live in your household. They're recommending considering mask wearing in your house, just like in the summer when people are coming in for the heat. People are now going to be sequestering because of the cold. So it's just important to take all the precautions that we can, because the
Yeah,
fall and the winter are going to be worse, which they anticipated and we're seeing already. You know,
we
we're
are.
having 6 cases a day, so it's mitigating. So hand washing, social distancing, or hand sanitizer for 20 seconds and mask. It's key.
Mhm. It is key. Thank you so much. Well, the last question I have for you today, and really probably one of the, I say you have all of the hot topics. So thank you for coming and spending some time with us. But one of the last questions that I have that I really want to talk about is stress. Um, Moms are reporting a high level of stress before COVID. And now that COVID has set in, their stress just has continued to increase. What would you say to your moms and the families out there that are expecting a little one? How does stress impact pregnancy first?
So as I said, luckily the studies have shown that moms and especially newborns are not being affected overwhelmingly by COVID. That's the most important thing. Second, to minimize the risk, I didn't say this before, of catching COVID, they are recommending the flu vaccine for as many Americans as
Mhm.
possible, so you're not battling the flu when COVID knocks on your door. As far as stress, everyone's under stress. The little ones, the teenagers, the college students, the Generation Z, millennials, everyone's under stress. The grandparents can't see their grandbabies. So what I actually did for the first time over a lunch break last week is just take 10 seconds to meditate, 10 minutes to meditate. You have to find quiet time to reflect, whether it's listening to your favorite song in the bathroom and dancing it out, whether
Yeah.
it's listening to your favorite song while you take a shower, whether it's reflexology. There's so many self-help apps out there now. I ran across one in the spring called Teacups. There's a lot of free apps out there for self-help. Right now, there's one called Shine that sends me a message every day. Last night it was, how do you feel today? Well, how do you feel? How do you want to feel tomorrow? And reach out to someone you love. It's SHINE. If you're religious, there's Bible apps. We can't hug each other now, Zoom, FaceTime, WhatsApp. I have a ongoing communication with my best friend and her 6 sister-in-laws. We text each other positive videos and positive phrases, and we lift each other up every day. We've been doing that for over 18 months, and that's really helped. So you just have to find a connection, and you have to find a way, if it's a warm bath with candles or music playing, if it's yoga, stretching, exercise. My youngest in our family became a vegan in May, and the timing of that, she's now meditating and learning chakras and doing yoga. Her mind is in a different place than it would have been if she had started this journey on her own. So I think you have to find what gives you peace, and reach out to those who can help you find that peace. We love our family, but if they're doing this and you're borderline, so you have to, it doesn't mean you can't love them every day, but you may not want to spend an hour on the phone with them. You may want to give them 10 minutes if they're escalating your anxiety. And the important things, take your vitamins, keep your appointments, send in your messaging through the My Chart if you have questions, or if we're not your doctors, to whoever your doctors are. There's, the electronic media technology has given us easy ways to communicate.
Absolutely.
So, and, social media and the internet are good. When COVID started, what I call my sister and I, we were on COVID watch. So at some point I said enough. No more COVID watch. We're not sending any more articles. We're not doing this. And then with everything that happened this summer, I said, sister, only positive things now. No more ugly videos, no more things that are going to stress us out, only positive videos. And so now I send positive quotes from LinkedIn. I don't do Facebook, but from LinkedIn to, uplift the kids and the older people too. And, the grandparents are suffering. We have big plans for Christmas, and grandparents and great grandparents aren't going to be able to hug and kiss their babies. And so everyone is just, it's a tough place, and it's not going to be over for a while. The best thing we can do is wear our masks.
Yeah. And
It's
really,
so important.
I love how you really are in control over what is coming into, like, what's shining on you. So if something or someone is stressing you out, you really need to take those steps and limit that.
Yes.
Well, Dr. Robinson, is there anything else you would like to share with our moms that are expecting out there right now in the area? Are there any things I didn't touch on?
I think the important thing is, when in doubt, ask, don't assume. And I think one of the most harmful things are moms that have significant psych history. By the time they get to us, they've stopped their medicines because that's what they or their family doctor decided was best. Please call us, especially if you're an established patient. We can give you an opinion or a thought, or get a virtual visit scheduled tomorrow, or get you in urgently so we can have a discussion, especially in this time. We do not want moms stopping their meds if they're stable, unless it's Paxil or unless it's an ACE inhibitor. There's very specific medicines that we do not want in pregnancy, but there's few and far between. So please call and talk to your team. And it's going to be okay.
It's going to be okay. Thank you so much for joining us for this session, and I appreciate you.
Thank you.